Hello and welcome to Incubator and Beyond. Today we're going to be talking about tracheostomies. What is it? Why do you need one? And how we live our daily life with one. Let's get started. Let's start with what is a tracheostomy. A tracheostomy is where they make a small incision in your neck. The incision is called a stoma. And they make a small incision in your neck and then they put a trach in it to create a direct access from your trachea down into your lungs. This will bypass the mouth and throat. This is often used for people who have trouble breathing, issues with their airway, sometimes a neurological issue. Why is a tracheostomy needed? It could be needed for multiple reasons, such as airway obstruction, long-term ventilation for chronic lung disease and things like that, secretion management for people who are unable to clear their own secretions, and some structural abnormalities or neurological issues as well. Some information about the daily life. A lot of people need the tracheostomy with a ventilator. The ventilator will help them breathe. It produces air that will affect as if they were breathing, as well as an option to keep their lungs open if they have a problem with collapsing the lungs. Also with speaking, more often than not, they cannot speak without a speaking valve. So if they're on the ventilator, they do have inline and off the vent speaking valves. We do not have one yet, so I can't touch too much base on that. For eating and drinking, you can eat and drink with a tracheostomy. My daughter was doing it for the first year. She's unable to do it now, but you can eat and drink on a tracheostomy if it allows to. It's very by person, and it just depends on your situation. For things like activities, it is harder to do things. It does come with a lot of equipment that you have to bring with you. It's important to stay away from anything getting inside of the trachea. So avoid water, avoid desert windstorms, avoid anything that can cause something to get inside. As for like infections and secretions, it's important that it's cleaned regularly, and we'll go over how to clean it as well as suctioning to prevent infections and blockages. To clean a tracheostomy, you're going to want to gather your supplies. The supplies include a new trach. If you're doing just a cleaning, the trach will just stay in and you'll work around it. You'll want a tie, a gauze, and a saline wipe. Now you can also use the Q-tips. They have care kits that you can get as well. These are the only items that we use. So to start with cleaning, we're gonna say that we're just doing a regular cleaning, and we're gonna say that the trach is already still in and it has a tie already around it. So what we're gonna start with is we're going to untie one side and hold it in with the other one. We're then going to take a saline wipe and we're going to use a corner and pull away. Always pull away. Don't go into it. Pull away from the stoma. And then as you move around, you need to switch your finger position. So you're going to start in a corner, then swipe. Then when you're ready for a new swipe, you move your finger to a different clean corner, swipe that. Different area on the wipe, swipe that. Always away from the stoma. You do not want to just wipe over the stoma, and you don't want to wipe on areas that you've already touched. You don't want to get infections. Once you're done wiping the stoma, you're going to go ahead and wipe the entire neck. So the tie can come all the way around. You're still holding this in place right here. And then you're going to wipe all the way around the neck. And this can be anything. This part doesn't matter. The stoma part matters. So wipe the neck, and then you want to make sure that you dry it. So take a dry cloth or the other gauze pad and wipe it all dry. And then you will take the tie. You'll put one end of the tie on this end, still holding it in with the ventilator if needed, and then wrap it around and tie it. While doing that, you'll want to make sure you take a good look. Make sure there's no redness, no need for any antibiotics or creams if it's red or granulated. Granulated means an excessive amount of tissue. Adapting to a tracheostomy life can be stressful, but finding families and support like medical teams, therapists, peer groups is very essential. It's helped me through it. That's the reason why we're doing this, is we want to spread awareness. We want you to know that there are resources out there. There are other families in similar situations, and we're here for you. Thank you for joining us today. We will continue to make posts. If you have any comments, anything I left out, any questions, please feel free to ask them in the comments. We're here to help in any way that we can. If you would like to join our podcast, please also comment below and we will reach out. Thank you so much.